Hello, everyone. It's Thursday, July the 14th. We want this number to be 0. We've got 8 additional deaths since the last time we were together on Tuesday. Again, I offer up, please offer your prayers, and if you happen to know these people, please call. The 7,092nd death is an 83-year-old male from Jefferson County. The 7,093rd death is an 86-year-old male from Nicholas County. The 7,094th death is a 72-year-old female from Fayette County. The 7,095th death, an 82-year-old female from Greenbrier County. The 7,096th death, an 84-year-old male from Raleigh County. The 7,097th death, a 94-year-old male from Clay County. The 7,098th death, a 75-year-old male from Greenbrier County. And the 7,099th death, an 85-year-old female from Mineral County. We have 2,889 active cases in West Virginia, 1,000 new positive cases, 1,030 since the last update. Our daily positivity rate is at 8.79. Our cumulative rate is at 8.22. We have recovered cases of 532,104 in West Virginia. We have 330 people hospitalized in West Virginia now. It continues to go up. We have 39 in the ICU units and 5 on ventilators. All the map is green, mostly all yellow, and there's 1 Gold County, and that's McDowell. I remind you over and over about your booster shots. I've done it day after day. If you're walking around and you're per se fully vaccinated, you had 2 shots of Moderna, 2 shots of Pfizer or your Johnson & Johnson original vaccine, and you don't have your booster shots and everything, you're really exposed. You know, really and truly now you should have had your 4th shot total if you're Pfizer or Moderna, and you should probably have had your 3rd shot if you're Johnson & Johnson. But you've got to get those booster shots, especially the folks that are above 50 years of age. From a standpoint of our numbers, they continue to move north and continue to slowly but surely crawl upward. The bottom line of the whole thing is whether it be hundreds or thousands that we can get across the finish lines, that is absolutely for sure equates into somebody or several folks that we're saving their lives. So absolutely, we continue to try. Please help me. Please help me get more people across the finish line with vaccinations and or boosters. From the standpoint of the vaccine calculator, all the information is up on how you can get access to the vaccine calculator to where we can notify you properly when you're supposed to get your booster shot or vaccine. All the stuff on our COVID vaccine info line is up on our website. We have 80 outbreaks in our long-term care facilities. We have none in our church community. We have 95 inmate cases and 64 staff cases in corrections. In regard to our rental assistance program and homeowners assistance program, if you're a renter, you're a landlord, a homeowner, please contact us if you have any deficiencies that you're worried about, whether they may be you couldn't make your house payments on time, you've got utility payments that are behind, and we can look at it and tell you if we can get you some tax-free financial assistance, and absolutely, if we can get you qualified, it could put real dollars in your pockets, and all those dollars coming from the Fed side, if we get dollars in the pockets of West Virginians, we cause a multiplier effect and good things for West Virginia. We'll do it right. We'll abide by every law. We'll absolutely turn over every rock to try to qualify you, but we'll do it right. From the standpoint of giving blood, I encourage all to do so. The Red Cross is standing ready to help. They need the blood without any question if you've recovered from this terrible pandemic, and others as well. But those people that have been, that have absolutely contacted COVID and recovered, please, please, please check with your physician and see if there's a way that, that you should be considering giving blood. Bad storms happen, and they continue to happen from time to time. In the state of West Virginia, I've said it 1,000 times, but the mountains are really steep and they're really severe. And when we get, a bad storm hits and everything, as it did just a couple days ago, you have real situations that can really be magnified in certain areas of our state. It just so happened that the county this time was McDowell, and I'm declaring a state of emergency right now for McDowell County, due to flooding that occurred on this past Tuesday. There's all kinds of issues there, but there were 75 homes that have water damage. Many residents are still in McDowell County without water, and a county really and truly that has been the salvation of our state and our nation in many ways. On the great people of McDowell County stepped up, mined coal, absolutely got us through World War I, World War II, and absolutely with all in us. We kind of ran off and forgot that county, but I'm not going to forget them, and they're in need right now. I would ask you to offer up your prayers, and we'll run to the fire and help them every way we possibly can from the state standpoint. There's a couple of projects. One is University Avenue. The University Avenue project has now been awarded, and yesterday I approved a bid for this major project and everything to improve traffic flow and relieve congestion at West Virginia University. We have been doing projects, and West Virginia is no question a really, really busy place. And with Morgantown is a busy city today, a lot of business opportunity and things going on, as well as our university that's there. This project is one of a series of projects undertaken by our DOH in recent years to widen University Avenue and other streets along the major transportation corridor through Morgantown and past, and out past the West Virginia University. So the estimate on the estimated completion of the project will be spring of 2024. It's a $5.5 million project, $5,478,000 and change. So I'm happy that we got that out. It's one of the roads to prosperity funding, and so lots of good stuff going on in Morgantown in lots of ways. Maybe we can make it a little bit better. Another announcement is Paul Hardesty has been unanimously elected as the new president of the West Virginia Board of Education. I was able to, to recently, I guess in December of 2021, appoint Paul to that job. I appointed him, to the Senate in January of 2019. Paul's a lifelong friend, a very, very, very outstanding individual with a lot of qualifications. Paul gives up so much to serve our great state, and he's done a great job. He loves education. His heart's right dead in the right spot. He was the president of the board down in Logan County, and Paul is a good man. He'll do a great job. We congratulate, Miller Hall is just the president going out at this point in time. Miller, what a job he did. I mean, it was off the chart. And these are friends. They're lifelong friends, and I just can never thank him enough. Tom Campbell just left the board and everything. We'll have to replace Tom's spot, but what an incredible job Tom's done too. And again, a lifelong friend. I congratulate Superintendent Birch and all those on the board. I mean, they're working really hard. They continue to make us proud, and so I know Paul will lead and do great work there. Now I've got a couple other announcements, and these are tough, but I think it's Gigi Mansion, Mark's wife, and we just lost her last night, and so actually she died early on Wednesday, but this is a great family. Dr. Mansion is leading the charge at Glenville State University now, and I've had the opportunity to interact with this family in many ways. I just the other day on a potential person, job opportunity for people that are possibly coming to West Virginia and bringing 100+ jobs and everything. I met Mark's daughter, a beautiful young lady and everything, and really impressive, in the opportunity that I had right here in the governor's office, with the group that was in that, working on a project to bring employment to the southern part of the state, and so I would never ever say to any family, no matter of all the difficult things that we go through, and this very statement really upsets me a lot, is when you turn and you say, I know what you're going through. Well, we don't know what they're going through. We do not. We never do. And really and truly, all we can do is offer up our prayers and tell the Mansion family, I'll promise you from my standpoint, I love you and love you with all my soul. And this great lady will be greatly missed, but what a legacy of family that she leaves behind. And so, Mark and everybody, I can't say that anything more than I just hate it. I'm really, really, really sorry. The other thing is I just was notified about 30 minutes ago that Carlton Barney died last night. Carlton Barney, an icon across this nation and world for his incredible insight and expertise in decorating and his flair of personality. I had the opportunity to be with Carlton Barney many, many, many times, and what an just engaging, exciting talent that was unbelievable. I mean, flat out unbelievable. So I just found out, don't know any of the details. I think he was in Europe and he died last night. And, another great, great, great American that we'll miss, and we'll miss in every way. These great people provide and give us a lot of wisdom, and they give us family, they give us opportunity. Absolutely, it is, these people will really be missed. So God bless them both, and please look after all the family. That's all I have right now. Thank you all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
And as the governor pointed out, our hospital numbers are slowly increasing. And as General Hoyer shared during the last brief, we are closely monitoring that and looking at perhaps lower threshold for us to activate other approaches in anticipation of making sure that we maintain hospital capacity now in this sort of new COVID era with staffing challenges that still persist. When we look at the current drivers of COVID-19 and the impact of the virus in West Virginia, we recently have received sequencing assessments from our university collaborative between West Virginia University and Marshall University. And we learned that in the last week of June, during that sequencing run, about 1% or so of those samples was the BA.5 variant, and that's the variant that is now most dominant in the US, with about 70% or so of the cases of COVID-19 in the US being from the BA.5 variant. In the first week of July, another sequencing run was done. And at that point, the BA.5 variant increased from about 1% of the total to 33% of the total. So as we have anticipated, the BA.5 variant is taking over from the other variants in West Virginia as well as the rest of the country. And while we may not be quite to where other parts of the country are yet, we know that the BA.5 variant is by far now the most infectious variant that we've seen to date. And we know that it also has the ability to reinfect people who have been infected previous with other forms of COVID-19, including the BA.1 form, the initial Omicron variant form, and also people that have not been keeping up to date with their vaccines or who are out for 2 to 4 months after their vaccines. In some recent data, it's demonstrated that even as soon as a month after recovering from COVID-19, people can be reinfected with the BA.5 variant. And as we said before, the ability of the BA.5 variant to infect is related to its ability to bind to our body's cell receptors and gain entry in our bodies better than other Omicron variants, more like the Delta variant did, to multiply quickly in our cells, and importantly, to evade our immune response. And that's the reason why it is so important for us to make sure that particularly our vulnerable citizens are up to date with their vaccines. Because what we're seeing is really a kind of a split in the road, depending on which country is reporting their data from the BA.5 variant. When we look at South Africa, that had a lot of challenges with the BA.5 variant. They saw the cases go up, they saw the hospitalizations go up, but they did not see the deaths go up. And that was reassuring to many people. But other countries like Portugal, that's an older population than South Africa, they saw their cases go up, their hospitalizations go up, and they saw their deaths go up, about to the level of the BA.1 variant, the early phase of the Omicron variant that we saw in the United States, which led to more deaths and more hospitalizations. And now, as we look at New Zealand, they've also seen their deaths go up to get to the sort of the same sorts of levels as we saw with the initial Omicron variant there, the BA.1 variant. And Los Angeles is also seeing an increase in mortality. And given that West Virginia has such a vulnerable population, an older population, we very much want to reinforce the benefits of staying up to date with your vaccination. So please look at the vaccine calculator, figure out whether or not you're eligible. And if you're eligible, please stay up to date with your vaccines. Don't wait for the new vaccines. Take a vaccine now. Very important. And that's really the reason why the White House is considering making all adults in America eligible for an additional booster shot, the 4th vaccine, if you got the first 2 vaccines from the Pfizer or Moderna families. So really important that we stay very vigilant, and we know that BA.5 is growing in West Virginia. So it is really important, given how infectious it is, for us to take provisions and protect ourselves and protect each other. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. As many of you have heard, a new vaccine has been approved. Just want to let folks know that our Joint Interagency Task Force and our team at DHHR will be working with the appropriate folks at the federal level. We'll be understanding what the order process as well as the availability and numbers for the state of West Virginia. And I suspect sometime next week we'll be able to provide West Virginians with more information on that. We also want to assure folks we continue to have our discussions with hospitals, long-term care facilities. As the governor, Dr. Marsh, pointed out, our numbers, in addition to that total number, want to remind folks that we also look at the daily number of intakes, and today it was 54 new admissions with COVID. So we continue to pay attention to that. We are engaged, as we have been, in weekly operations calls. Those occur on Thursday. So there is, in addition to those regular weekly discussions with health departments, hospitals, long-term care facilities, our community clinics, and others, we will have additional conversations. And in addition to that, it looks like now probably around the first week of August will be our tabletop exercise. Question was asked yesterday, I believe, by Charles Young, related to what is our trend data showing us. Right now, we are on a path. Should things not change, we are on a path to sometime right around a Labor Day timeframe to be at that 500 mark in the hospital. So again, continuing to monitor these things. Governor presses us daily to make sure we're on top of these things, and we'll continue to work those. Thank you.
All right, thank you, sir. Dr. Amjad and Secretary Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Stephen Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Not going to keep asking the same questions about the tax plan, but I am kind of curious to know if you are considering other appropriations bills for the upcoming proposed special session. I know we're sitting on a whole bunch of our ARPA money that I know you all are developing plans for. And of course, we are going to have extra tax revenue surplus money to play with as well. So I didn't know if you all were prepared to or talk about what you may or may add to a possible special session call in the way of appropriations or other items along those lines. Thanks.
Stephen, I still think we've got time, and we're not ready to go with the appropriations, that we would recommend at this point in time. We're getting real close, and but we've got the funds won't actually be available really until a short period of time out. They're still out in front of us, but I think the funds are really not available till the end of August. But we'll get to that real soon. We're working on it, but we don't have that finalized.
All right, thanks, Stephen. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Thank you, General Hoyer, for providing that information. And so I guess I wanted to just ask, is sending in the Guard the only option or strategy we're considering if and when we get to that point? What are the other approaches or options that we have for backstopping the hospitals? Thank you.
General, you've got to take that, sir.
Yes, sir, Governor. So, Charles, it could be a number of things, and what we'll do is the current discussions in the tabletop will inform decisions and things that may need to be in place by either the facilities themselves or something that we might recommend as a team to the governor. But obviously, right now there's a lot of discussion about hospitals that may have relaxed some level or facilities that may have relaxed some level of preventive measures like masks to increase those things, additional sanitization efforts, particularly airflow, those items, as well as the potential of being prepared that if we might have staffing issues to bring in some additional folks from the Guard. But all that will be informed as we work through and up to and through the tabletop exercise. So it could be a variety of options to help reduce the challenges that we might have in facilities. Thank you.
All right, Charles, thank you. Stephen, did you have another question?
Yeah, and Governor, I just want to get your thoughts on this. I know you just talked about Mr. Hardesty getting elected to head up the presidency for the State Board of Education. I don't expect you to comment on the pending lawsuit in regards to Hope, but I am kind of curious. It does seem to me there kind of seems to be very much a difference of opinion between the Department of Education / Board of Education and the legislature over how to best come up with a system of educational services in the state, a difference of opinion, a difference of philosophy. It seems with the election of Hardesty, who obviously was a lawmaker and someone who spoke very, very eloquently and forcefully against some of the majority Republican ideas for education over the last few years. Is there a way, and I'm kind of putting you in the peacemaker role here, is there a way to try to bridge these differences of opinion? You've talked about that yourself, that there's obviously a difference of opinion in regards to Hope. Is there a way to bring everybody together on the best way to provide education in the state? Thanks.
Well, Stephen, I surely hope and pray that there is a way to always do that. But let me just tell you my feelings, I guess is the easiest way to start. I'm a real believer in public education, and I really believe that we need to try to provide for our kids and make opportunities better and better each and every day. From the standpoint of either private or charter or whatever you want to call it, schools, and giving people a choice, to be perfectly honest, I think now that we've seen enough experiments and everything, people do need a choice. At the same time, right behind that, it will be healthy for us. It will be healthy for us to have more and more, basically, competition amongst ourselves for us to strive to do better from the standpoint of public education. But to stand back and just beat on public education, just to beat on public education and say, they're not doing a great job, and on and on and on, or to stand back and just cheerlead public education and say, from the standpoint, no matter what we do, this is what we want to do, and we don't want to listen to parents, we don't want to do this and that. I can't agree with any part of that, no part of that. So really and truly, Stephen, from my standpoint, I would say first and foremost, who really matters? Who really truly matters? And then we should start right there. Who matters are the kids, our children. Our children really matter. This is not something that we ought to be, which I'm very critical of all the time, getting on a soapbox and jumping up and down and saying, look what I did, and I did this and I did that and everything else. There's no place in my life for that. No place at all. And I can tell you that I've got all the confidence in the world in our board, in our state board. I've got all the confidence in the world in Paul Hardesty. I've got all the confidence in the world in Clayton Birch. Now, and many, many, many others that are down there that are doing absolute great work. From the standpoint of standing back, throwing rocks, it's ridiculous. It's totally ridiculous. And your point is, should we find a way to have harmony and real peace and understanding with one another and perpetuate the very thing that really matters? And that is doing more and more and more good stuff for our kids. You're dadgum right. And I absolutely will perpetuate and try as hard as I can, as long as God gives me breath, to just do exactly that. I don't know how you could be a coach. I don't know how you could be involved with schools as much as I've been involved. I don't know how you could be involved with or see what the progress of communities in schools and absolutely not want anything but one thing, and that is more and more and more goodness for our kids. The idea of us standing one side, throwing a rock and throwing back and forth at one another is ridiculous, totally ridiculous. And I'll go to work even harder because we need to do even better.
All right, thanks, Stephen. Governor, I'll turn it back to you.
Okay, I'm just trying to look at the notes that I took, but I think this came from Dr. Marsh, but he's right. Dr. Marsh sometimes doesn't as forcefully maybe as I do it, or maybe as dynamically as I do it, or animated. But he basically said to us that older populations, whether it be Portugal, I think he mentioned, or wherever it may be, older populations are seeing a significant increase in deaths. We have the opportunity to prevent that. Now, we don't have much of an opportunity to change the fact that West Virginia is an older population. But we do have the opportunity to prevent the deaths from the standpoint of the boosters or vaccines or whatever it may be. And so we've got to just not go to sleep at the switch. We've got to recognize right off the get-go that we are older. We've got to recognize that we're positioned to where go out there at the turnpike, anywhere you want to go to one of the toll booths and sit there and look at the cars going through. 76% of the cars that are going right through or trucks are from out of state. 76%. So what does that mean? People from all over are traveling right through us. The likelihood of them bringing COVID or this terrible disease, whether the variant, whatever the variant may be, is pretty dadgum high. If you're not vaccinated in West Virginia, there's a dadgum good chance you could very well end up with this. Even if you are vaccinated, there's a significant chance that you can still end up with it. But the difference is really simple. Dr. Marsh again, our coronavirus czar, a super brain, 42 times more likely to die if you haven't been vaccinated. Come on. West Virginians, you didn't get to where you are today in life. You didn't become the craftsmen of the world. You didn't become absolutely the great, great peoples you are, not looking at reason and logic. 76% of those vehicles out there are from out of state. If we didn't have one bit of COVID here, 76% of those people traveling right here today are bringing it to us. It is unbelievably infectious. 76% of them are bringing it. It is unbelievably infectious. And if you're not vaccinated and you get it, Dr. Clay Marsh, our coronavirus czar, says you're 42 times more likely if you get it to die than if you were vaccinated. Come on. Come on. Let's just be smart. Come on. The only other thing that I'd add is General Hoyer threw out, just a statement. It's a big time number. 54 new admissions to hospitals today. It's a big number. We got to pay attention to all this. I'll promise you that we are, and all of our experts are. I thank them again and again for the job they're doing. They're doing great work. I remind everybody, all of our lawmakers, all of the folks that are involved in education in every way, all the unions, everyone, all that's at stake is one thing. That's our kids. That's our kids. Don't hide behind the bush. At the end of the day, we want to do the right thing for our kids. So with all that, that's all I've got today. And God bless all of you. And please remember Gigi Manchin and Carlton Barney in your prayers today, and all the others that we lost. The 8 folks we lost, and the 7,099 people in West Virginia. Great wisdom and everything else that we've lost. Thank you so much. That's all I've got.